Thank you, Assemblymember Schiavo, and we really appreciate your ongoing life's work on single payer. And I think one of the points on the question of federal waivers, because this bill is focusing on a policy bill, and we've taken the ACA with the financing, and put that aside for now. We really wanted to focus on the policy legislation, so that there wasn't any confusion about the legislature acting on a financing plan, because the plan is to be able to speak to that in the years to come after we get the policy legislation moving forward. And just so that everyone is clear with the federal waivers, Congress doesn't have anything to do with federal waivers. It is a process that has been outlined in the Affordable Care Act, with the U.S. Department of Health and Human Services, and they have very strict regulations that include a requirement that a bill has to be passed, a policy legislation has to be passed before it can actually start to consider a federal waiver. On a number of points that Assemblymember Schiavo pointed out, I just wanted to clarify that the savings that the Healthy California for All Commission found, that it was very specific. It's the closest study that we have on the bill that we have before us today on AB 2200, where it includes no copays, long-term care for all. And the range just depends on how much the UC Berkeley Labor Center had estimated in terms of the increase in inflation generally. So depending on how much inflation happens, we'll save either between 30 billion to 200 billion plus. So, yeah.
And I just want to mention, the legislative authority. So that amendment, or that text you're referring to, was an amendment that was taken the last iteration when there was a separate ACA. Legislative authority will certainly be attached, particularly the financing component of it, when it does get to that at some later stage. But that being said, there is definitely a fine balance of making sure that the CalCare board's powered versus having to come back to the legislature for too much and encumbering the kind of the daily operations of CalCare being effective. But I'm definitely open to more suggestions and thoughts on it, and we can give you more background on why that was done back when on the earlier iteration in context of the ACA, and more than happy to get back to you on that.
Thank you.